Now we're going to look at how to assess the mouth, plan and record mouth care. Recording oral care is essential and provides the evidence that care is taking place. Documentation should include an oral health assessment on entering the home, an oral care plan and daily monitoring of mouth care. It is important to assess the mouth care needs of all residents as soon as they start living in a care home, regardless of the length or purpose of their stay. Being person-centred is about focusing care on the needs of the individual, ensuring that people's preferences, needs and values guide decisions, and providing care that is respectful of and responsive to them. Every effort should be made to involve the individual in planning their mouth care with support from family or friends who know the person. Please follow the guidance in the Mental Capacity Act, and if they lack capacity, involve next of kin, anyone with a lasting power of attorney, or an independent mental capacity advocate. During the oral health assessment, you should consider, what does the mouth look like? What are their oral health needs? What are their likes and dislikes? What support do they need with their oral care? Can they cooperate with either self-care or supported care? Do they have a dentist? And when did they last go to a dental appointment? Do they have medical needs, and does this affect their mouth? And are there other lifestyle factors you may need to consider? There are examples of assessment tools you could use in the accompanying toolkit. For example, the one shown here is one which was developed by NICE. Here are some of the questions you might like to ask about the residents' likes or dislikes. For example, when do you like your mouth cleaned? What toothbrush or toothpaste do you like to use? And do you use anything else? How do you clean your dentures? What do you use? And do you have any other likes or dislikes? You also need to consider if there are any additional risk factors which might affect their oral health and ability to self-care. For example, poor nutritional or fluid intake, a high sugar diet, dysphagia or swallowing problems. Are they on a modified diet or pureed food or thickeners? Perhaps they may have suffered a stroke and experienced weakness or paralysis, which is making self-care harder. Are they on cancer treatment? Or do they have diabetes, making them at higher risk of gum problems? And any infections in the mouth could increase their blood glucose levels. Do they have a dry mouth, which might be to do with medication that they are on? Do they have dementia and need prompting or help to care for their mouth? And what is their alcohol or tobacco usage? Both of these affect the risk and increase the risk of mouth cancer, and smoking causes gum problems. Where appropriate, use the assessment as an opportunity to educate the resident or their family members on up-to-date advice for mouth care, or give other public health messages. If they are independent, this can be a time to inform the resident of the importance of oral hygiene and methods for good practice to maintain their oral health. It may also be a timely opportunity to discuss their smoking and alcohol usage. Deciding on the level of support that the individual needs is key to developing their care plan. Use this assessment to identify how to assist those residents who cannot clean their own mouths. Some questions that you might wish to ask are, do you need support to clean your mouth? And what support do you need? Can you walk unaided to the sink? Also, can the individual carry out all aspects of toothbrushing themselves? And are they able to clean their dentures? They may say, I can do it myself, or I need a little support, or I need a lot of help. Not everyone in care will have good oral health. They may arrive with poor oral health and unmet needs. They may have medical conditions which affect their oral health and ability to self-care. And their level of need for support may well change over time depending on their situation. If possible, the resident should continue to see the dentist they saw prior to becoming a resident. The care home may ask if family or friends may be able to help to organise their visits. So ask the resident, do you have a dentist? When did you last visit? Do you pay for dental treatment? And how do you usually get to the dental practice? How to find a dentist will be covered in section 6. It is also important to ask whether they have any pain or problems with their mouth. If you are concerned about anything, or you find something when you check their mouth, make a note, tell your manager, and consider referring to a dentist. Please ensure all care staff have washed their hands and wear the appropriate personal and protective equipment to carry out an oral health assessment. Ideally, use a pen torch, as it can be difficult to see in the mouth, and this must be disinfected after each usage. When you look in the mouth, check and record, do they have their own natural teeth, and how many? Do they have dentures, and are they able to wear them? Are they full dentures or partial dentures, top ones or bottom ones? Do they have metal parts, or are they just plastic? Do they have a name on them? And where are they kept when not in the resident's mouth? There are separate slides in the toolkit that give a systematic approach to checking the mouth and indicate what to look for when completing the sections in the NICE Oral Health Assessment tool, which you saw earlier on. This assessment tool covers the lips, oral cleanliness, saliva, dental pain, tongue, natural teeth, dentures, gums, and soft tissues. And each of these categories is scored a 0, 1, or 2, depending on the listed criteria against them, making a total score out of 16 for the whole mouth. If the person has a score of 1 or 2 in any section, then this will need careful recording. Inform your manager and consider referring to a dentist. The mouth should be reassessed in line with other care planning, for example monthly, but an assessment should be repeated more often for those that have a higher score. This is a way of tracking improvement or deterioration in the overall condition of the mouth. So when looking inside their mouth, have a look at their lips. Are there any cracks, bleeding, changing colour, lumps or soreness? How clean is their mouth? What does their saliva look like? Are they experiencing any dental pain? Does their tongue have any sort of unusual coating or ulceration? And check their teeth for decay, sharp tooth edges, or if they're broken. Check the fit of their dentures and look for cracks, sharp edges, or missing teeth. Ill-fitting or broken dentures can cause damage to the mouth, so document in the notes the reasons for not inserting dentures and notify their family and your manager. Also have a look at their gums. Do they look red? Are they bleeding? Is there any swelling or soreness? And what does the rest of the inside of their mouth look like? Be alert for anything which looks unusual. Oral cancer can affect the lips, mouth, or throat. It may appear as red, white, or speckled patches, lumps or bumps, unexplained speech patterns, or difficulty in swallowing, or ulcers or sores which don't heal. Any ulcer present for 2 weeks or more, even if painless, must be investigated by a dentist. Early detection of mouth cancer is important, and if in doubt, get it checked out by a dentist. Visiting a dentist regularly is important, as they have a good look in the mouth and they always check for mouth cancer. If you are concerned about anything, please do record your findings, inform your manager, and consider referring to a dentist. Knowing what a healthy mouth looks like will help carers to recognise what may be unhealthy and when there is a need to seek advice from a dentist or doctor. So a healthy mouth has teeth which are clean. The tooth surface is covered in enamel and free from tooth decay. Any fillings are intact and there are no broken teeth. The gums are pink and they don't bleed when brushed. The skin inside the mouth is pink and moist, with no ulcers, swelling, redness or white patches, and the tongue is pink, symmetrical, and has a slightly rough surface and is moist. And the lips should look smooth, pink and moist. The floor of the mouth underneath the tongue should also be moist with saliva. Always consider if a change in behaviour, such as pulling at the face or a change in appetite, might be due to dental pain. If you are concerned, please tell your manager and consider referring to a dentist. The assessment tool is used to develop a person-centred care plan for that individual, which should be regularly reviewed. It should include details of mouth care, how, when, and who is responsible for delivering it. If a resident is usually independent, note if a prompt is needed, and if you have given advice on technique, products to use, and frequency of brushing or anything else. It is important to record the products that will be used too. And this will ensure that oral health is delivered in a way that will provide maximum benefit. The level of cooperation and support needed should also be recorded. Where possible, allow the person to manage their own oral care unless they are unable to do so. Family and friends can be encouraged to assist in the delivery of care where appropriate. Ensure you record details of the resident's mobility and how they will access the dentist. Will they be able to go to the dental clinic, or will they need a home visit? Also, please record the date and outcome of any visits to the dentist. Example of care plans may be found in the accompanying toolkit. Mouth care needs to be recorded in the home. This is evidence that the care has been provided to meet the needs of that resident as detailed in the care plan. If it was not possible to clean the whole mouth, note which areas were cleaned so that the next carer can start to brush the teeth previously missed. Remember that for many people with dementia, it is not a willful act to refuse care, but rather a sign of confusion and distress. If somebody regularly refuses oral care, keep a record and discuss with your manager what action should be taken. So, in summary, the appropriate mouth care plan for each patient will be determined by the oral health assessment. Care is then carried out following the care plan. The oral health assessment, care plan, and daily log of care should all be documented. Review care plans regularly as the condition of the mouth or the level of support may change. And staff should know how to report oral health concerns and how to seek dental care.